Hello, my name is Chris Sandals. I am the Medical Center Director for the Central Texas Veterans Healthcare System. If you're watching this video today, it's because I was unavailable to join you for new employee orientation as I typically like to, but I still wanted to be certain that I had an opportunity to share some really important information with you, both about the Department of Veterans Affairs and about the Central Texas Veterans Healthcare System. So I've been with the VA for 15 years, and here in just a few months. And I remember when I joined the organization as the son of two veterans. My mother is an Army veteran, my father is an Air Force veteran. I thought I knew a lot about the VA as I went with them to medical appointments at VA medical centers. But what I quickly learned when I joined the VA after finishing graduate school is that the VA was much larger and much more complex than I could have ever imagined. So I want to share some of that detail with you today as you start your journey with the Department of Veterans Affairs. So what is the VA? Well, let's start with our beginnings. Our organization was breathed into life by the 16th President of the United States of America, Abraham Lincoln, when he was giving his second inaugural speech shortly after the Civil War concluded. In that speech, he said a number of things, but specifically a phrase that I'll share with you here. He said, "Let us strive to finish the work we are in, to bind up the nation's wounds, to care for him who shall have borne the battle, for his widow and his orphan, and to do all which may achieve and cherish a just and lasting peace among ourselves and with all nations." So if you were to go to our headquarters, which is located at 810 Vermont in Washington, D.C., there's an excerpt of this comment that you'll see on the side of the building. And specifically it says, "To care for him who shall have borne the battle, for his widow and his orphan." Those words started the Department of Veterans Affairs. So what is the Department of Veterans Affairs? Well, let me start by talking to you about our leadership. The VA is a cabinet-level organization, meaning that our secretary is appointed by the President of the United States. Our current secretary is a gentleman by the name of Dr. David Shulkin. Dr. Shulkin is a physician, and there are a couple unique things about Dr. Shulkin that I think are important for our staff to know. Well, for one, Dr. Shulkin was the only nominee by President Trump to receive 100% consent by both the House and the Senate. No other nominees can make any claim of the sort. He's also the very first non-veteran to hold the position of Secretary of the Department of Veterans Affairs. In that capacity, he has responsibility for our entire organization, which has an operating budget of somewhere around $275 billion. That funding is split between three partnering but separate administrations. So I'll talk to you briefly about each one of them. Now, the first, which is where you and I work, is called the Veterans Health Administration. You'll typically hear us refer to it as VHA. So what is VHA? VHA consists of over 160 separate healthcare systems. It is the largest integrated healthcare system in the United States of America. We have over 1,500 sites of care, about 360,000 employees, and we're actually the #1 employer of nurses in the entire country. Now, these sites of care cover not just the continental United States of America, but we also have sites of care in Guam, Puerto Rico, the Philippines, and the Virgin Islands. So as you can see, we cover lots of territory. Now, we have 4 primary missions here in VHA. Obviously, healthcare is one of those primary missions. We also have a really significant research arm. Most large VA medical centers have research corporations on our grounds, as we do here in Central Texas. Education is also a very important part of our mission. Most don't know that 67 to 70% of all physicians in the United States of America have at some point practiced at a VA medical center, either as an employee, obviously, which we'd prefer, but many through their graduate medical education, either as medical students or as residents or fellows, rotate through our organizations and help us provide care to our nation's heroes. But in addition to physicians, we have academic affiliations with almost every healthcare specialty that you can imagine, from nursing to health technicians to imaging techs, even to administrative occupations, much like the program that I came through the VA as a part of. Last but not least, our fourth mission is support to the Department of Defense. Specifically, this is support in the case of a national emergency. While our infrastructure is primarily geared to care for veterans, in the case of a national emergency, should the Department of Defense require, our facilities would be available to the general public. So that's a general overview of VHA, again, Veterans Health Administration. So what are the other two administrations that make up what we call VA? One of the other two is called VBA. That stands for Veterans Benefits Administration. So interestingly, while we in VHA have the largest staffing level, I told you earlier about 360,000 employees, believe it or not, we don't have the largest budget. The largest budget is in VBA. So VBA administers many of the programs such as the GI Bill. So I know with our 42% veteran employee rate here at Central Texas, a number of you I'm speaking to are probably veterans yourselves. So if you have a GI Bill and you went to college under the GI Bill, that's administered by VBA. If you have a service-connected pension, that is administered by VBA. Vocational rehab, home loans, life insurance programs. There are a multitude of programs that the Veterans Benefits Administration manages, and we work with them very closely, but again, there's a separate administration. Last but definitely not least is the National Cemetery Administration. So while we here in Central Texas don't actually have a national cemetery in our catchment area, we do work very closely with our national cemeteries in Dallas and in San Antonio. What I'd like our staff to understand specifically about our national cemeteries, one is that they truly are a national shrine, and if you haven't visited one, I would encourage you to. But most importantly, it's important for staff that work for the Department of Veterans Affairs to be certain on key holidays like Memorial Day that we visit our national cemeteries and help the American public remember what the price of freedom is. So we'll talk a little bit more about VHA and the resources that our veterans utilize. So across the country, there are about 20 million veterans. About 6.2 million of those veterans receive their health care at the Department of Veterans Affairs. If you actually look at all utilization of all VA resources, VHA and VBA make up about 76% of all the services that veterans actually utilize. And like I said, about 6.2 million actively receive their health care from VA. Now, what I often, some of the information I share that often surprises people is that contrary to what many of you, and I'm sure your friends and family may see in the news when some of the negative media is shared about the VA, we are actually a rapidly growing organization. Now, not just here in Central Texas, which we'll talk a little bit more about in a second, but really at the national level. If you look at the statistics, in the past 10 years, VA enrollment has grown by over 22%. Of veterans receiving health care, growing from about 5.2 million veterans receiving health care at the VA to now 6.2 million veterans receiving their health care at the VA. And many ask, how have we been able to make such increases in our veteran enrollment and utilization in the midst of what many perceive to be negative news media and things that don't shed a positive light on our organization. So I'll talk to you briefly about some of the things that have allowed us to continue to grow and meet veterans' needs. But I think the best way for me to give you a quick overview is to allow you to watch a video that I've embedded in my presentation that will tell you briefly what we do in VHA to provide healthcare services to our veterans.
Did you know nearly 6 million American veterans have chosen VA healthcare? More than a quarter of all veterans, and many more may be eligible? Did you know VA provides healthcare exclusively to veterans and their families? And 1 out of every 3 employees of the Veterans Health Administration is a veteran? No one understands your needs better. Did you know VA facilities outperform private health, Medicaid, and Medicare on key preventive care services such as cancer screenings, diabetes care, and cholesterol management? Your VA health team is dedicated to helping you achieve optimum health throughout your lifetime. We do this by giving you access to 1,700 locations nationwide and bringing care to you through mobile clinics, vet centers, and telehealth services. We do this through innovation, connecting you to your healthcare team through secure messaging, mobile apps, and 24/7 online access to your medical records. And we do this by being leaders in the use of medical technology and pioneering new, smarter ways of delivering care. VA offers a full range of healthcare services to men and women. Whatever your needs, we are here to help you. VA Healthcare also satisfies the ACA health coverage requirement. Applying for VA Healthcare is easy. You'll receive your enrollment status within 7 days. Find out how you can benefit. Explore VA today.
All right, so thank you for watching that video. So there were a couple key things that you saw in the video that I want to spend a little bit more time talking to you about. So one of the things that you heard is that enrollment in VA allows veterans to meet the requirement of the Affordable Care Act for healthcare coverage. This is one of the ways that VA was able to continue our growth as a healthcare provider when that law was effected in 2008. We also had another change in legislation, one that you heard a little bit of allusion to in the video, but I'll tell you a little bit more about it. So in 2014, our previous President Barack Obama signed a law that we refer to as the Veterans Access, Choice, and Accountability Act. This law gave veterans, like many of you that I'm speaking to, the option to receive some aspect of their care in the community. And some of you may have received a little white card, and it's got a 1866 number on it. And if you read it, it's referred to as your Veterans Choice Card. This gave us the ability as a healthcare provider to supplement the care that we provide our veterans with care in the community. If VA was unable to provide that care because we didn't provide it in our local area, or because we weren't able to meet the veterans' needs timely. And so as a result of our ability to do that, we've continued to see enrollment in our healthcare programs because veterans know that if the VA can't provide their care, and then we'll be able to pay for that care in the community. But we've also made a number of other changes in our processes that have continued to bring veterans to us. For example, across the country now, all 160 healthcare systems have same-day access in primary care and mental health. Now, same day doesn't always mean that if a veteran walks into the clinic, that every veteran should be able to walk into the clinic and be seen, but it does mean if a veteran contacts us for primary care needs or for mental health needs, whether it's by a telephone visit, a secure message that they can send their provider, a secure video telehealth session, or a walk-in visit, that we're expected and we will meet that veteran's needs on the day that they come in, specifically in primary care and mental health, which were the national requirements. But some healthcare systems, just like us here in Central Texas, have taken that to the next level, where we now provide same-day access in areas like audiology, same-day access in podiatry, and same-day access in optometry, services that many of our veterans need. And given our ability to provide those services now on the day that they're needed, we've continued to see rampant growth in our healthcare system. But we've done a couple of other things that have allowed us to continue to grow. As you heard in the video, we are the #1 provider as a national health system for telehealth services. So you name the telehealth modality, from primary care to dermatology, cardiology, audiology, we provide it in some form of telehealth modality, including mental health, to allow us to take our care to our veterans, whether they be veterans here in our cities like Austin, Temple, and Waco, in the case of Central Texas, or our more rural veterans, and now have the option to receive mental health services or primary care services from the comfort of their own home. So as we've continued to provide additional modalities to see our veterans, we're having more veterans come to us. One of the other things that we've done, largely driven by our secretary, Dr. David Shulkin, is we've to become a transparent organization. There's a website that you'll see on the PowerPoint slide, www.accesstocare.va.gov. But on this website, not just our staff, but any of our stakeholders, from congressional members to patients, can log in for all of our 1,500 healthcare systems, 1,500 sites of care across the country, and know exactly how long they should expect to wait for a primary care appointment, whether they're a new patient or an established patient, or how long they would expect to wait for any of the specialty services that we provide at those care locations. They can also get information on that same website about how satisfied veterans are with their care at those respective locations. And as we continue to be a transparent organization, we've continued to see veterans' perception of trust in our organization go up, increasing from about 47% in 2014 to the low 70th percentile in 2017. So we're continuing to see that as we're sharing information, as we're becoming more innovative and accessible to veterans, their trust and their utilization of VA is continuing to increase. But we've also put a lot of emphasis on who we bring into our organizations. So I've got another video that I'd like you to watch. This is a video not from Central Texas. It's from one of our sister healthcare systems of a nurse talking about her experience as a nurse working with the Department of Veterans Affairs.
I'm Nikki Fryer, the nurse manager of the Cardiovascular Cath Lab here at the Durham VA Medical Center. 24 years ago when I started here, I just thought it was an opportunity to gain some basic nursing skills and that I would pursue other clinical opportunities in the community of nursing. However, as I grew to love the working with the veteran, I found it to be very humbling to come here every day to serve them. I've seen many changes in this facility as a whole, not only how we provide care, but for how we care for the veteran and their families. There are a lot of physical changes to the plan of the organization, but more than anything else, how we care for them. A veteran that I remember very well was, we had an encounter with a veteran who came in through the emergency department undergoing a myocardial infarction, and we brought him to the lab, and he was very emotional. We didn't quite know why, but after the procedure was over, we understood that, and he revealed to us that he was actually a homeless veteran. And that was very touching for us because he was very appreciative for the care that he received that day. So just having that compassion for the veteran and making sure that the care that he received, not only from us, but also the care that was coordinated with other services, with the chaplain, with social work, with volunteer services. I can go on, that when he was discharged, that we made sure that he had the resources in order to be seen back in our clinic, that he was able to maintain his medication regimen that was required post-procedure. And, but more than anything else, it was an opportunity for us, which we were very successful in reconnecting him with his family. So, sorry, I'm so sorry. It is the true sense of family, is the true sense of caring, is the true sense of respecting the veteran for where he is at that point in time. This veteran, and we still see him today in our clinic. The VA is what I consider a community. It's a community of healthcare providers. It's a community of patients, veterans. It's a community of families that we come together for one common good, and that is to make sure that we provide the best care for our veterans possible. I don't see myself leaving the VA. I will continue my career here. It's been enjoyable. It's been rewarding in more than one way. You establish relationships with patients, and whether it's in the coffee line or in the intensive care unit, it really makes a difference to have that connection with that veteran and that family. I'm Nikki Fryer. I care.
Every time I watch that video, I get choked up, and I've watched that video at least 20 times as of today. But that just gives you an example of the passion that our employees have when they come to work for the Department of Veterans Affairs, all of which have come to us because they have a special connection with our mission, and it shows when you interact with them. Last but not least, in our journey to become a more accessible and a healthcare provider of choice has just been physical updates and modernizing our facilities. So for staff who've been with us for a while, they could talk to you about the changes that they're seeing happening in our healthcare system, but we're continuing to look for ways to modernize our organization so that when our veterans walk into our facilities, that their initial impressions are that we are a modern healthcare system, much as they would expect to encounter in the community. So let's talk a little bit more about the Central Texas Veterans Healthcare System. So I told you that there are 160 VA healthcare systems across the country with 1,500 sites of care. So the Central Texas Veterans Healthcare System represents 10 of those 1,500 sites of care. And that may seem like a small number to you, but these are not small sites. We are actually considered one of the largest and most complex VA healthcare systems in the country. Last year, which was fiscal year 2017, we cared for nearly 105,000 veterans. This was across our 10 sites of care. Now, those 10 sites of care are responsible for 35,000 square miles in the state of Texas. We have sites in, obviously, Austin, in Temple, and Waco. We also have community-based outpatient clinics. You'll often hear us refer to them as CBOCs in a myriad of cities, and I'll just give you a few examples. We have sites in Cedar Park, Bryan College Station, Palestine. We have an annex that provides primary care mental health services right here in Temple. We have another clinic in LaGrange. We have a sleep clinic in Killeen. So we have sites across the Central Texas area trying as best we can to move the care to where our veterans are. Some other unique things about our healthcare system, we are just down the road, about 25 miles from Fort Hood. Fort Hood is the third largest military establishment in the United States of America, which gives us unique opportunities to partner directly with the Department of Defense and to share resources, both physically and staffing resources. And we're continuing to build on new partnerships with Fort Hood. And our operating budget here in the healthcare system is about $800 million. That covers your salaries, and it covers any other expense in the organization, from keeping the lights on to any of the care that we provide for our veterans in the community. And as of today, we're right around 3,700 total employees. So a bit more specific clinically, we are the true definition of a clinically integrated network. We are a 2-hospital system. Those hospitals are obviously here in Temple, where our acute medicine surgery services are located, and our Waco campus is primarily a psychiatric acute campus. So we have 36 acute psychiatry beds located there, in addition to other programs that provide some degree of mental health treatment, like a seriously mental ill program that we refer to as SMILE. We also have a non-psych program there, our blind rehab unit, which is a 11-bed unit. And we have some what we call CLCs, or community living centers, similar to nursing homes, located on both of our hospital campuses, so both here in Temple and in Waco. We have inpatient rehabilitation programs. We have an inpatient military sexual trauma program. We have a domiciliary, which is located here on the Temple campus. So you name it, we offer it. We have infusion centers. We have 2 of those that we operate. We have 3 dental operatories. And I mentioned earlier some of the other services like audiology and optometry. And in addition to all of those services that we provide ourselves, we do operate a true managed care program. So there are some veterans that receive all of their care in the community, and as the payer for that care, we are solely responsible for coordinating it and being certain that our veterans receive the care that they require in the community and have a smooth transition back to VA for the services that we need to provide here. So let's talk about the important stuff now. Why are you here? Well, you may relate to the 42% of our staff that I referred to earlier that are veterans themselves. Many of our staff who've chosen to give their work life to the Department of Veterans Affairs have family members that have served, or some have family members that are actively serving. Some have told me stories about the loved ones that they've lost on active duty. I share this with you because it's most important for you as an employee of the Department of Veterans Affairs to find your personal connection. Because we are such a large, dynamic healthcare system, we will have interactions with our veterans at nearly every point in their lives. Some of those will be high points, like the birth of a child. Some of those will be low points, like recovering from substance use disorders or post-traumatic stress disorder, or dealing with the loss of a spouse, or transitioning into hospice care, or recovering from homelessness. So it's important for you to have that connection because you're going to have days that are difficult, either in the amount of workload or perhaps in some interactions that you may have with our veterans if we don't catch them at one of their best moments. So it's important for you to have that connection, know why you're here, and keep it personal. Because when you have those difficult days, you're going to need that to fall back on to remember why you decided to join this organization. What I will tell you is that if the only reason why you came to work for the Department of Veterans Affairs was the salary, this isn't the place for you. One, because I know in most cases VA can't be the top payer, so you may be able to go to the private sector and make more money if that's all that's of interest to you. But if you're interested in serving your country, making a difference to those that you're serving, and knowing exactly why you made the decision to do so, you're in the right place, and I welcome you. One of the things I want to highlight to you is how much we value diversity here in this healthcare system. Truly, the Central Texas Veterans Healthcare System is a mirror image of the veterans that we serve. When you're walking our halls and walls, you're going to interact with people that are different from you. Different genders, different races, different ethnicities, different nationalities, sexual orientation, color, etc. And so what I think is important for anyone that decides to make this organization your employer is to know that you need to value diversity. You need to be able to interact with people that you work with and people that you're serving that are different from you. And if that is something that you can't do, again, this may not be the place for you. And we wouldn't be upset if you decided to excuse yourself, but understand if you don't excuse yourself and you have difficulty working in a diverse environment, I'll excuse you myself. Last but not least, I think it's important for anyone that joins this organization to get involved. I've been with the VA, as I told you at the beginning of the video, for 15 years, and it's been a great career. The Central Texas Veterans Healthcare System is the 5th VA healthcare system I've worked at, and I can tell you it is one of the best. There are a number of opportunities here to get involved. Get involved for promotional reasons and training that you can get specific to the job that you're in. We can help you develop other technical skills if you're interested in changing career tracks. And there's a myriad of leadership training that you have the opportunity to participate in if you aspire to service level, facility level, or perhaps national level leadership. But ultimately, you're going to get out of your career here what you decide to put into it. And so the more you invest, I can guarantee you the more you will get back. So with that, I want to welcome you to the Central Texas Veterans Healthcare System. If you do wish to get in touch with me, on our homepage, once you get your computer access, you'll see a link there titled Speak to the Director. That allows our staff to email me anonymously if you don't want me to know where it came from. Otherwise, you can always shoot me an email in Outlook. The last name is Sandles, S-A-N-D-L-E-S. First name Christopher, should be easy to find me. Again, welcome to Central Texas.